Hi, we're starting to go over the process for care after your ablative laser today. It's fractional, it's not fully ablative, so it shouldn't be too bad, but I'm getting it done. This is the device behind me that we'll be using. After we're done with this, I will be showing you your post-treatment care. But I wanted you to see me prior to that because I'll probably be pretty swollen and red next time you see me. I just got back from having the treatment done and I'm hot. I'm really hot right now, so I'm gonna go lay down and do my ice packs. But I want you to watch the progression of swelling. And there's a little tiny bit of oozing going on, and that's normal. It's Tuesday morning. My treatment was on Monday afternoon. My night went well. I definitely got up in the middle of the night and did my soaks. I was hot and the ice felt great. I took some Aleve as well. Today I got up, did more soaks, and then took a shower. So the next thing I'm going to be showing you is how to do the soaks. It's been 24 hours since my treatment and I've already soaked 3 or 4 times, but now I'm going to do it again. It was 4 hours ago that I last soaked. I feel a lot better today. It's a little hot and almost itchy in my neck, but not uncomfortable. I've been working at my desk all morning. I have all my supplies ready. And so I've washed my hands prior to starting this video. I'm gonna go ahead and put on gloves just to be extra clean. And then I'm opening up 7 of these 4x4s. So now they become 4x8s and putting them in my water. It's got the dome burrow and water in the water bottle that I've kept in my refrigerator. So it's nice and cold. Only do this into a fresh, clean bowl every time, preferably one that's been washed in the dishwasher. Our biggest concern of a complication is an infection. And until my skin's all closed off, I have to do everything I can to prevent bacteria from getting on there. So there we have it. My gauze is in there. I have taken my gel pack out of the freezer and put it in a fresh new Ziploc bag. That's not sterile, but it's clean. And the next thing I'm going to do is take my Cetaphil cleanser and put it all over my face because I want to get off that Aquaphor gel. And it's kind of greasy, but it keeps your skin nice and moist. The Cetaphil for me does not sting. We did have one patient that it stung. For some reason, it's just soothing for me. Now I have some fresh paper towels here. I'll take my gauze. I want you to notice my bed. So I've done 2 things. I've covered my pillow with a towel. I think you should do it, especially last night. There was little red spots because you do get little drippy blood, not a lot, just a little. But I don't want this stuff on my good linen. And then here, I've covered my where I fold over my bed with a beach towel because where my neck is, I'm afraid that I'm going to get Aquaphor on my sheets. So I'm just going to lay down right now and take a 15-minute break and let myself relax. So the way I'm going to lay out these gauze is I like to do one across my forehead. And you know, I wouldn't tell you that it feels hot, but when I just put that on there, it felt so good. I guess it is hot. So I'm going to do one down the sides of my face and one down the other side of my face. And then I'm going to do one across kind of my nose and my upper lip. Let me do it like this. And it's loose, so it's not a problem to breathe. And then one across my chin. And because I had my neck done also, I'll do one there and one here. And then I'm going to just sit here for 15 minutes and let the ice do its thing. I'll move it around. You don't want to get frostbite, so you keep moving it around. Okay, time's up. So just now I did that for 15 minutes, but yesterday I actually did it for longer because it felt so comforting. And you know, this cold is one of the best ways to keep comfortable and also help mitigate the swelling. Last night, I did take a Benadryl. Benadryl can help with swelling. helps you sleep. And I also took some Aleve. You could take Aleve or Advil, ibuprofen. Those are anti-inflammatories. Not a bad idea when you're first going through this. I'm going to get up now and go rinse off my face and then show you how I put on the sanitizing spray and the Aquaphor. Okay, I'm ready to rinse off the soap that will help get off the Aquaphor. And I'm actually using cold water. And I'm just gently rinsing it off. I will say, and I said this yesterday, my neck is more sensitive. Now you may be just getting your area around your mouth treated or just your neck. I had all those areas treated. If you just got around your mouth or just your neck, you'll only use a couple of gauzes. The other thing is I do want to mention, if you've had your face treated, you could have extra puffiness under your eyes. So I'm going to use a clean, fresh paper towel. We have tear ducts here. And so I often will try to press that lymphatic fluid from outer corner in to see if I can get some of that puffiness to go down a little faster. You just hold a little pressure there. That's all you need to do, a little bit of that. I'm gonna just dry up. We gave you either a bottle like this or a brown bottle, and this has a sterile fluid in it called hypochlorous acid. It doesn't sting. Alcohol would be a terrible thing to give you, but this kills bacteria amazingly well. And even if you squirt it right in your eyes, it's no more rough on them than swimming pool water. In fact, that's what it smells like. So I'm just gonna spray my face and my neck. So now I've put something on my skin to help kill bacteria that may be on there. And then I'm going to get my Aquaphor. And you really don't want to contaminate the tip, so I just try to let it fall into my hands. And then I'm just going to spread it all over. Again, this just provides a soothing layer. It helps keep the areas moist until we stop getting drippy, and it's soothing. Tomorrow I will be less swollen than today. I'll still be red. I'm going to be red for at least a week, but the swelling's only going to get better from here. This is probably the worst that I'll be. Feeling pretty great, and it's not hard. It's just that, you know, I'm not going to go out to a dinner party. It's Wednesday morning. My treatment was Monday afternoon. I'm actually a little more swollen today than I thought I would be by now. I'm not oozy at all. So technically, I don't really need to be wearing the Aquaphor, but it is comforting because my skin feels like it's going to start to peel. You'll see, it will look like cotton from a washcloth or something, just little tiny pieces that will be coming off. And underneath that is this beautiful fresh skin. It's Thursday morning and I definitely feel like I'm getting more presentable. Today in the shower, lots of skin peeled off, and I mainly used my fingers, although I did use the washcloth a little bit. But if you look up close, my new baby skin is starting to show, and so it's going to be so much better. I'm going to go put on some makeup so you can see. You really could go out today if you wanted. So today's Thursday, treatment was Monday afternoon. I went in and put on this Oxygenetics foundation this morning, and I think it does help mitigate the redness. It's not completely perfect, but it is better. The beautiful thing about this product is it's antibacterial, so it helps prevent infection after this treatment. It's oxygenating, so your skin can breathe while you're still healing, and it's got great covering potential. The redness will persist for a few days, but the skin on the face heals so much faster than the skin on the neck. So my neck actually looks older today. The skin on the face has started to shed, and there's this baby skin under there that is so smooth looking. But the neck isn't going to start to shed probably for another week or two. So don't be alarmed if your neck is looking older than your face when you're only 4 or 5 days into this thing. It's Friday morning. My treatment was Monday afternoon. And the first thing I'm going to tell you is I was wrong about my neck. For photofacials, it does take 2 or 3 weeks for that brown coffee grounds to slough off. But I was so happy because yesterday afternoon it started kind of peeling and it is so much better today. It was time for me to start the Tensage ampules. And these come like this. There is plastic inner part and you squeeze it and it gets the cotton filled with the material, and then you put it on your treated area. Just around your mouth or your neck, a half of one of these is fine, but you will need a full one for your full face and neck like I did. Tensage is interesting. Tensage was invented because when Chernobyl melted down, everything around that city died, except for one variety of snail. And within 2 days, they had completely recovered. So scientists started researching how could these little critters live with that exposure to radiation and not be burned up. And what they found is they had these special enzymes in their slime that self-healed them. So they started doing studies with this stuff. The first people where they used a product made from it had radiation burns after cancer treatments. So they've created a skincare line, but why we've given it to you is it's a wonderful product for when you've had a burn, which is what we've done. And we have seen people have quite a bit of diminished redness once they get on Tensage. So you should enjoy that. The other thing I'll say, I went by the office yesterday and bought some other products that I hadn't been using that were post-treatment products, and I feel like I'm so much more comfortable. So the ladies at the front desk have all the knowledge on that. And if you feel like you want something else, I would suggest you speak to them. Today's Saturday, and I feel like the swelling's gone. Yesterday, it peeled and peeled and peeled, both my face and neck, like every 4 hours. I wanted to get all that skin off. Today, just a little. I really feel like I'm over the hump. We're going to a party in about an hour. I don't think once I get my makeup on, it's going to be a big deal at all. All right, I'm signing off. This is Saturday night. My treatment was Monday. Got makeup on. It's still red without it, but I feel like I'm pretty much done.